Hello. Happy Monday. I hope you are hearing me on your end. I'm just going to pop over and see if you are seeing me on your end. I hope everyone had an awesome Mother's Day weekend. It was beautiful here for a change, so I was out digging in the yard. Probably got a little more sun than I needed to. But it's a great time of year to visit mom, help mom with her work in the yard. Love to hear how you guys spent your Mother's Day weekend. If you are joining me today and you can see and hear me, please just make a little comment and let me know that if there's a little delay if you're joining us through Facebook, but it does look like I'm live on that end. So for now, I'm going to shut that tab off. I want to get into a little bit of information. If you're not familiar with what today's session is regarding, today we're talking about Ehlers-Danlos syndrome, EDS. Also, to a degree, there's been some changes, and anytime there's changes in legislation, especially when it comes to the medical side of it, we're also talking about HSD today. So there was a change in the world of diagnoses. Thank you for letting me know that you see and hear me, Blaze. For those of you that know me from my group, you know that I ramble. And I've invited many from my group here today because many of them are so many of you are dealing with hypermobility issues in general, which is sort of what EDS is about, but there was a diagnosis change a few years back. So you don't need to get a new diagnosis. Sometimes, we didn't know what we didn't know, and even in the medical world. So unless you're participating in research or joining up in a case study of some sort, you do not need an official new diagnosis if you have EDS now and have been dealing with it. But there was a change. Thank you, Mary Liz. I was struggling for the year 2017. So going back 5 years, there was a change, and there's a lot, like the word spectrum. I'm going to say that a few times today. Any one condition and the symptoms associated with it are never the same for everybody. So in my group, I'm going to guess if I ran a survey, I probably 60 to 70% of you are dealing with hypermobility issues. But so many of my clients are not diagnosed. And many of them have been living 20, 30 years. I mean, symptoms can be managed. So that's what we're talking about today is if you have issues, you have hypermobility, everybody else you've talked to says, yes, you have EDS or you have HSD, HDS, but I can't give you the official diagnosis. That's something that you'll find as well. Only certain doctors are able to technically diagnose you with certain conditions, vascular surgeons being one of them in the realm of what we're talking here about today. So what I'm going to do is I'm going to get into a little bit of information. For some of you, this is going to be a repeat because guess what? Using a vibration machine and light therapy or massage tools is not associated with the condition you have. It's aligned with the symptoms. So a lot of the things that I do for my clients that are dealing with EDS or hypermobility issues in general are the same things I would recommend for somebody that's dealing with osteoarthritis or poor balance issues. It's not about the condition. It's about the state of your body and your ability, what you're able to do and willing. That's the one thing I can't impose enough here. So I've dropped one link there. What is the difference between EDS and HDS? I believe that was from the Rare Disease Disorders website. But there's one more that I want to drop because everybody's going to ask me after the session, well, what's the best way to use a vibration machine for EDS? And it's not about the best condition for EDS. It is about the best, what is best for you personally, regardless of what you're dealing with. So I want to make sure you guys are seeing those come through on the other end. Hello, Elizabeth. Hello, Mary Liz. Hello, host. I guess that's me. Hello, Dolores. Hi, Jude. Hi, Judy. Oh, I'm going to screw that up at some point. Hello, Blaze, honey. It's been so long. I got to do a live here on my own at some point, but I'm really excited, and I want to thank LifePro for giving me the opportunity to ramble about, yes, believe it or not, yet another medical condition. Hydration is key. One of the big things when you're starting to use a vibration plate for the first time, whether it's for EDS or not, things are moving, and lymph being a big one. So you want to make sure you're staying hydrated. So what is EDS? And I know I'm going to screw these acronyms up a few times today, but as always, I went to the National Institute for Health in the US, and they define it as a genetic disorder affecting collagen formation and function. I bet you didn't know collagen had a function. It's not just something in your face cream. It affects virtually every organ in your system, and it can result in significant morbidity and mortality. This is where the scary part and the PG-13 part comes in. Complications of this disease are extremely serious. They include arterial rupture, organ rupture, joint dislocation, joint pain, fatigue, and many, many, many other conditions. The scary ones, this is word for word out of the National Institute for Health. But in extreme cases, it is absolutely possible to see those type of things. Some people have problems caused by hypermobility, which is the more common population that I deal with. Hypermobility doesn't necessarily mean that you have EDS, but you do not have, you may have some of the symptoms within the hypermobility spectrum. So hypermobility spectrum disorder is HSD, which is treated the same way as HEDS. It's going to get so confusing here. That's why I wanted to give you the links. So for those of you living and managing with the symptoms of these conditions, this is language you speak every day. For those of you that are joining us from the awareness side, many of others maybe joining us from Life Pro and their VIP groups, what is EDS? It's probably something you've heard about, but usually unless you personally or someone you know is affected by it, you're not really paying much attention to it. So exercise and EDS is what I'm going to talk a little bit more about today. And I'm also going to talk about just ways that you can manage your symptoms. So if you want to read a little bit more about EDS or HSD, or think that you might be dealing with, everything just feels loose. Like, I don't have hypermobility disorder, but I have a really bad joint that I never dealt with. And sometimes it feels like it's doing this kind of thing. And, living in a state of this can attack every orifice of your body. Pain and joint dislocation, fatigue, those are some of the big things I mentioned earlier that I deal with. But associated with pain and fatigue comes just another whole other realm of mental health and physical conditions, because your body's always trying to deal with the fatigue and the pain and other things. So symptoms are unique to each of you, as are your current level of health and where you're starting. So I want to ensure, if you suspect you have EDS, if you do have EDS and you've never dealt with any of the toys I'm going to be talking about today, please talk to your doctor about tips that I'm discussing here first to ensure that it's suitable. Not everyone understands what EDS is, and not everyone understands the tools that I'm working with. So know that I'm always here as a resource, as is Life Pro, but we are not doctors. We are not here to diagnose, offer treatment protocols. Based on my experience, I want to make sure that resources are out there. And if you are dealing with a situation where you're not getting guidance, you don't have access to educated support, feel free to reach out to me at Debby with a Y, and I'll see if I can't point you in the right direction. So first part we're talking about today is exercise. So when you're dealing with EDS, like any other condition, if you look up anything on the internet, diabetes and exercise, cancer and exercise, EDS and exercise, you're going to see 4 things. 4 key things should include aerobic, strength, flexibility, proprioception, balance. And I'm going to did I put this link in already? I may have put this link in already. I think that I did put this link in already. So this one is about activity. And what happens with activity? Lots of things. We know that our body improves when we are dealing with a moving body. We are not meant to be stagnant sitting in our chair 8 hours a day. So, I always used to say in my early sessions, 1,000 years ago, we used to sit on our bare feet and butts in the forest. We used to poop and pee in the forest, and we'd squat, and we'd do all these functional things in our day. Industrial times and all our computers and our new modern conveniences, we physically do so little that we have to take out gym memberships and physically make a point of being active, because it's that lacking in our day-to-day lives. We're intelligent beings, and we've always found innovative, easier ways to get things done. But our physical biology and not doing these physical tasks has created the reason I'm joining you today and many other past reasons. So exercise is medicine for your body. Depending on where you're starting at, obviously, if you're dealing with EDS and you run 10 miles a day, or, maybe you haven't left the couch in 6 months, are two completely different bodies, even though you have the same condition. So exercise in EDS patients should be encouraged. It should be encouraged to avoid high impact activities. So if you're dealing with EDS, it's kind of the same thing as if you had arthritis or osteoporosis. Again, it doesn't matter what the symptom is, it's you personally. So if you're dealing with instability, a lot of my EDS patients and clients have bone density issues as well, low muscle tone, again, exercise is the cure. So, but do avoid high impact activities. So that's going to include things like jumping and running and skateboarding and, climbing mountains and things. Contact sports are a big one. Not saying you can't do these things. Again, I'm not a doctor. Do not diagnose, don't treat. You need to discuss this with your care provider. So I take the approach on the vibration plates, which is what I want to make sure you guys can see me on my shaky machine. I'm going to go over here, and then I'm going to come back for questions after. I made myself, because my garden is so awesome, a fresh batch of cucumber mint water. Not a big water fan, and I find if I add things to it, I get much better. So today I have got the Rumlex 4D out. Every session I always do, including for EDS, is targeted in to be as most functional and effective in as little time as possible. And oscillating plates are the absolute best movement. So maybe you have a vibration plate, maybe you've never heard that term before. If you're dealing with EDS, the first thing short term that you can have the biggest impact on is improving your balance, reducing the fall. If you're already dealing with pain and hypermobile joints and you bruise easily, there's a lot of symptoms associated with this condition. The last thing I want you doing is falling on the floor. So oscillating is the movement that mimics walking. There's a few different names out there for it, but oscillating, pivotal, moves like a teeter-totter, side alternating vertical. It moves like how you walk, but with much less impact. And I said earlier, the key when you're dealing with hypermobility, pain, all the things associated with it, is to reduce the amount of impact. And if you are dealing with a recent fall, break, you're just scared, perhaps you're recovering for something, and you're not to be doing weight-bearing activities just yet, you simply modify what you are doing. And you also do this on those off days. So there's going to be those days where you're just not having a good day. For those of you that are dealing with EDS or think you have it and maybe just don't have a diagnosis, you have good days and bad days, especially on the fatigue side. So you're going to have days where you feel like you have all the energy in the world and you do a week's worth of work because you're not really sure how long it's going to last. And then you pay for it for a week after the fact. For those of you that deal with fatigue and chronic pain, you know exactly what I'm talking about. That'll resonate with you. So if you're having a fatigued day, or perhaps you've done a little too much elsewhere, it is summer and very commonly you're doing other things. You're out in the yard, you're going for walks with your kids, you're riding your bikes. So if you've been doing activity regularly and season has changed, you want to make sure you don't overdo it if you're starting on a vibration plate for the first time. If you have been using a plate for a long period of time, but you're incorporating other activities and you're finding that fatigue is setting back in, lessen the time on your vibration plate and use it more frequently. It's going to give you the advantage of boosting your energy through that movement of lymph and circulation that it gives you, but reduce your time and do it more often, maybe just a few minutes before you're heading out or when you get back. If you're having with EDS, very commonly you'll have days where the joints are very swollen, just very painful, and standing on the plate or just doing your normal activities may not be as tolerable. But when you're seated, we're not bearing our body's entire weight, and you can still get a lot of good lymph and circulation movement. So short term, we're going to address the swelling and the pain, but anytime you're using a machine, to a degree, your balance and your proprioception is improving. So if you've got to do other things and get out there and have your day, a few minutes on your machine before you get out and do your other activities will improve your balance and reduce that risk of fall while you're out and about. And the more often and the more consistently that you use your plate, the more the benefit is going to stick around. You might find that you're more stable longer and don't need to use it too often. Everybody's going to vary based on how consistently you're using the machine. So when you're first starting out, if this is the first time you've listened to one of my long rambles, I don't start slow on the machine. It's really not the best terminology with a vibration machine. Just like a treadmill, there's more than one factor in your settings. So in a treadmill, it's how fast you're going in your incline. That makes sense. You're not going to start up full incline and full speed, but when it comes to a vibration machine, we seem to think that I'm going to start really, really slow with the speed. But the other factor with the machine is the foot distance. And everybody thinks that we need to start really, really wide to get the most benefit. This is more important with today's session than every other session that I've mentioned it, which I mention it in every session. When you're dealing with hypermobility and painful joints, you want to reduce your impact to as little as possible. The wider you stand, the more you move. And for those of you in the VIP club joining me today that have a vibration plate, why do you always go for the jog? There's this mentality, we go to the jog position because it's on a vibration machine, but you'd never make it halfway up the block if you're dealing with EDS or arthritis. But logically on this machine, it kind of leaves the building. So I want you to not be in the jog. I want you to not be in the walk. I want you to be in like the strolling. I think I'm getting my markers. So this is like running, jogging, walking. I want your feet, you're shuffling like that little old lady across the floor. So if you're just starting out on a plate, whether you have a machine experience or not, whether you're dealing with a medical condition or not, two things you control: the speed, how fast that machine is moving, and the intensity, which is referred to as your amplitude. So on oscillating only, it's the only movement you need to worry about this with. The wider you are, the more you're moving. The closer you are, the less you're moving. So if you're having a bad day, you're just starting out, start closer and bring your speed up. Think about driving on a bumpy gravel road. When you're driving really slow, you feel all the bumps in the road, and your body's forced to stabilize and react and guard and protect. On a vibration machine, the really slow speeds, we think like a treadmill, I'm going slower so it's safer. The slow speeds are your Bosu ball, your balance, and we want to improve your balance, but I don't necessarily want to test it yet, especially if you're dealing with, the potential of falling and your joints are hurting you and you've got vertigo and fatigue. So bring your feet close, bring the speed up to a mid, even a high range. You're going to find it smoother and you'll need less time. So if you're just starting out, I don't want you doing a workout yet. Get used to the machine. How does it feel on those achy EDS joints? If you are having a bad day, perhaps a minute or two, just to sort of see how you feel. Give your body a little bit of time to see how you react to it. If you feel good, you can always come back and do more later. When I ask people, a lot of times on my page, people will say, everything you expected not to happen did. They're hurting. I know that they've either gone too long or too wide. And I say, well, tell me what you did. A lot of people say, I went for 10 minutes on my machine and it hurt me. What did you do on it for 10 minutes? What was your setting? Where were your feet? There's a few things I need to understand. I don't have the crystal ball. But 9 times out of 10, the answer I get is, well, my machine is preset for 15 minutes or 10 minutes, so I went that long. Well, just because the track at the high school is 400 meters, do you run the entire loop the first time, or do you just see how far you can go? So what I would suggest, because time goes fast and a lot is happening, reduce the time. Start your machine in manual mode, in oscillating, with your feet close,
On your Rumblex models, I want you in the 30 to 40 speed range. If you're using a Waver, a Turbo, a Hovert, the Mini where you've got 100, I want you in perhaps the 50 to 60 range, somewhere in the middle or a little bit higher. And just get used to, the combination of, if my feet are wide and I go slow, how does this feel? If you'll get to those higher speeds more comfortably, especially if you're dealing with joint mobility and pain, if the feet are close. And then once you're at a mid speed, just bring your feet apart an inch, perhaps 2 inches, to see how you feel. You'll get to a point where it'll just be too much. You'll feel it. The skin shaking around starts getting a little bit uncomfortable. I wouldn't recommend going really wide for at least the first couple of weeks, especially if you're dealing with a lot of chronic issues. Be conservative and progress. And what you'll notice after about a week is all of a sudden your energy levels are going to not only be boosted, but they're going to start sticking around. The stamina is going to start building a little bit. The balance and stability is going to be better. You're not going to feel, you second guess yourself and don't trust yourself because you've been doing that for a long time. But physically, if you look back, you will notice you are more stable and have probably had less events. And all you have to do is start having a relationship with your machine and start using it consistently. Even if it's just 2 to 3 minutes to start your day, every day, your day will be better. For those of you that are not so chronic, you're dealing with this, you're managing your symptoms well, you've got a vibration plate, usually the number one reason, the athletic or the more functional person with EDS will want to do fitness applications is that the gym itself is becoming a little bit too tough to manage physically or with my schedule or from a cost perspective. So if you are able to bear weight, whether you are fit or not, if you're standing on a vibration plate for the first time, just like the seated demo I just did, I want you starting conservatively. If you're going to the gym, if you're doing other activities, you don't need to add this whole big routine right off the bat. Same lesson, start with your feet a little bit closer to the center. Make sure the knees are always bent slightly. The taller you stand, the more you'll feel it in your vocal cords and your ears, and your head will start wobbling. If you're prone to headaches and migraines, this isn't going to spark. A lot of people say, yes, my vibration machine gave me a headache. But what actually gives you a headache is you're so used to guarding and protecting that area that when any stimulation gets there, you guard and protect and you fight it. And when you fight it, you become like this rigid popsicle stick, and the muscles and the tendons aren't allowed to do their job. So if you're feeling it too much in the head and you're sensitive to it, bend the knees enough. You'll notice the deeper you bend, and once you get into about a mid squat, you don't even feel it up past the chest cavity, the bottom of the ribs, you don't even feel it. If you're looking at exercising, this is the first variation I want you to experiment with for the first week. You might be sitting in a chair. If mobility is really poor or balance is really poor, but you want to start standing and the chair is kind of boring, but this is a little too much, you can put one foot on the floor and put one foot on the machine and just, sort of slowly put a little more weight onto that one leg. Or something I've shown in past sessions as well, if you have the AeroFlex step, this is an awesome, I have a lot of faves, but this would definitely be in my top 3 of things to go with your plate. Excuse me. So what I would suggest, and I'm going to bring this up, I'm doing mine on a slower speed than I would like you guys to so you can see it on camera. So you can start on your plate because you've got more surface that is ground level with the machine. So instead of having to take that step up, I'm afraid I'm going to fall, you can stand on your AeroFlex behind the plate, put one foot on the plate, and you kind of work one side at a time. Okay, and you've always got a good side and a bad side. So whether you're dealing with EDS or other things, maybe you've had a recent hip replacement, and you're able to bear weight, but you don't really want to do the machine yet. We'll put the bad leg on the back, on the flat, non-moving surface, and then put the weaker side on, and you can give it a little bit of extra attention. Or if you've got the one leg that's been doing all the work and this is the surgery side, you can give the good leg a little bit of attention until you're able to bear weight on both sides. You can also put both this takes a little bit more balance, but you can shift all the weight onto the one leg if you're dealing with that type of a situation. Another way that you can use your AeroFlex step, not only behind, but to make it a little bit more functional, you can place it beside your plate, stand on the machine, put one foot on the plate. This works really well if you're not quite ready to bear weight on one side, if you're dealing with poor balance like we're talking about today, or maybe you have head and neck sensitivities like I talked about earlier. This is a really good way to be more functional. You've got one foot on the plate. I'm not quite at the running. I'm kind of just off center by about 3 to 4 inches. And if you're wanting to work on strength, simply start by just going lower, like you're getting ready to sit in a chair. Hold still, no up and down movement. The best way to use your plate for fitness and EDS is to not move. Very slow, dynamic movements if you are an experienced user and you want to progress. But if you're just starting out, by not moving, those muscles are going to fatigue very, very quickly, and you're not going to have as much time and impact to irritate those joints. So that's just a couple of tips on that. I'm going to check in on vibration machine questions here. For those of you that may just be joining me or tuning in after the fact, again, it's never how do I use my plate for EDS or how do I use my plate for arthritis. It's more about physically with these chronic conditions where you are starting and able to progress. The plate is simply an environment, a low impact environment that reduces the amount of time that you spend exercising. It reduces the impact on the joints. It increases your energy, recovery, even your mood. So, but when you're starting out, the biggest caution is more is less. So more often sessions or more frequent sessions, but short little sessions, maybe 2 to 3 minutes, maybe a minute. And over time, you'll notice, like I say, the fatigue, the stability, the energy levels, those type of things are starting to change, and you'll be able to use the machine longer, but you'll also need to use it less often for the soft stuff. For your fitness, if you are dealing with EDS, it really depends on how often you're doing other things. I don't know if you're going to therapy in the gym, but like any activity, what your doctor has advised you, if they've said, you're okay exercising 4 or 5 times a week or daily, the machine isn't meant to be something to do on top of everything else you're already doing, but you can use it as a recovery or a warm-up tool to other activities. What I would like is if you are doing exercise on it, you're not just doing more and more exercise hoping to change results. You've got to be really careful with EDS. Like I say, the last thing you want to do is overdo it, be swollen, and be able to do nothing for a period of time. So a vibration machine is a really great tool just to warm you up for your day, your activity, and help you recover from your day. And whether you plan on being active or not, we all take steps, we all do stairs. Just the more you can function better in your day and have this tool to manage those symptoms, the more functional your day is going to be, and hopefully these symptoms will lessen and be an afterthought versus how you start every day. I need a drink of my water. I'm going to come back up here to see you 2 seconds. My lights are so stinking warm. Okay. So I think I have some of you joining me here today. Again, it is EDS Awareness Month. So I want to thank Hypervibe for letting me talk about, I've got a couple of other products I do want to mention, but I want to just very quickly, because we just wrapped up with vibration machines, I want to make sure I don't have any questions from newbies. So I see Blaze. I just got here from Mary Liz. It's all good from Judy. Yes, I can see you from Jude. Now I have the Beatles in my head. I got to say it again, Jude. Hello, Dolores. And Mary Liz again. Elizabeth. Okay. Tracy, hello. Thank you for coming. Hello, Brenda in Cincinnati. And then Blaze got both the links. Thank you for letting me know those came through. Melody has EDS as well as several other comorbidity conditions. Kathy also has EDS, but my docs disagree. Are there tests she can run? That's an interesting one. I do know that there are some doctors that are more versed. And like I say, I think there used to be like 8 different stages of EDS before some of these HDS revisions came through. So what I would suggest is the one link I dropped, Kathy, EDS versus HDS. You probably will navigate, maybe not in that document, but if you go into the website that I obtained it from, or check out the raresdiseases.org website. And that's probably your best source to find some information. Or just search Ehlers-Danlos awareness. There was a ton of stuff that came up. If you've got something going on locally and there's something you want to share about EDS awareness, if you're dealing with EDS, I invite you to make a comment. I'd love to give you guys an opportunity to shine. For those of you that are dealing with these conditions, sometimes it gives, some people hear about things for the first time on my sessions, and it's a lonely and humbling and overjoying and everything all at the same time when you've been dealing with something that just doesn't make sense. You've been told your whole life it's you or something that you're doing or something that you're not doing. And then all of a sudden you come onto a Life Pro Live and there's all these other people that have been living and managing with this condition. So you go from being completely alone and isolated to overjoyed and accepted and feeling like at least there's direction. I'm not guaranteeing you're not going to have any issues to deal with, but there's something about knowing what you're dealing with that just makes it so much more easier to cope and get perhaps, the help and the resources that you need to start functioning and living the best life you should be. It resonates all right. I'm in tears just listening to you. Oh, I didn't even read that before I rambled off here. Hello, Facebook user. And the fact that you are giving so much grace and understanding. You know what? I'm blessed. Everybody looks at me on camera and, there's skinny little Debbie. But you know what? I got thrown out of a doctor's office or 2 in my day. And it was because I was fat and I had to get a knee replacement. And, it was all my fault. So even though my path or my conditions may not be the same as everyone else, I want to be that hope that, you know what? There are things that you can do, you personally, and the minute you empower yourself with even if it's just a bit of information, you read 30 minutes today on something you didn't know. I love new information. The minute we stop becoming curious, and more importantly, when we stop becoming curious about ourselves, nobody's going to care more about you than you. Well, maybe me sometimes, but I just so many times it's not about a right or wrong. Every time I learn something new, I have so many of my clients that come to I didn't know what I didn't know, and I want to share it from the rooftop. So I've learned about EDS through many of the people I support in my larger fat disorders group, because it's a co-condition that so many of them with lymphedema and lipedema deal with. So if you're dealing, there's a lot of correlation between the loose connective tissue disorders and what we're talking about today. So keep seeking answers. A lot of times it's just dismissed as a symptom or what you're dealing with, when there may be something more underlying. But again, my approach on the machine, I don't care if you've got 20 different things. It's about what you personally are dealing with and able to do. And that's where you start. Thank you, Mary Liz, replying the diagnostic. Thank you for posting. That's a great link to just sort of compare and give you some more direction. See, my girls are here today. My other thing I wanted to bring up, I'm going to give you guys a couple more minutes to post questions, but instead of it being all about vibration machines, excuse me, it is also about any other therapy that makes you feel good. Here's another real big hint. Anybody tell me what this is? This is a red light panel. I've been doing more sessions out in my little shop studio, and I had a client in here this weekend I was using this on. Depending on what you're dealing with, I'm not going to get into a whole side chat about, oh, Debbie, what is the best red light for Ehlers-Danlos syndrome? Just like a vibration machine, it really depends on you. If you have body parts that are more affected by your condition than others, you may want to look at something that's more specific use to that area. If it's everywhere hurts all the time, something like the panel is going to do more effect. Red light has shown a number of benefits. Again, back to the empowerment piece, instead of 50, why is red light better, Debbie? Why is red light good for EDS?
Google it. Whenever I Google something, and sometimes there's good research, sometimes there's research to sell things, and then there's other stuff. But use your common sense. If 4,000 posts come up and the first 2 pages are good news about red light for EDS, you probably should think about it. Red light and infrared, and there's different lights, but red light and the visual lights, the ambers, the blues, the greens, whatever you're dealing with, is more on the skin surface. So if you're dealing with lymphatic in particular, is just below the surface of the skin. So you don't need to go like big, deep massage to get lymphatic movement. So red light is kind of good for skin surface and lymphatic stimulation, just because it's so kind. And with EDS in particular, sometimes the physical touch, sometimes a vibration machine, heck, sometimes even sitting in your recliner is just too darn painful. And many of you are prone to severe bruising, varicose veins, those type of things. So sometimes if your condition is so severe, even though you may want to get to these things, my favorite way to use red light for these type of symptoms is kind of that bridge the gap therapy. So my infrareds, my red lights, some of my massage tools are a great way to prepare you for using the vibration machine, maybe for a period of time, maybe just before your session. If you're in a situation work-wise where you're just not able to access your stuff during the day, what I love about some of the red light therapies that Life Pro offers and their infrareds, maybe there's something that you can have at the office with you if you have to sit in that darn chair for 10 hours a day. Maybe something that can be used while you're at work versus a big panel where you're going to light up the whole office. So there is never the perfect tool for every situation. You got to look at when is the easiest way for you to apply this. And a lot of my clients, even though you bought something for the intention of using it in your workout room at home, if you're only home 3-4 hours a day and you're at the office 14 hours a day, you should look at something for your chair or the office, because that's where you're going to have the best downtime. Multitask and treat yourself while you're developing all the issues and irritating those symptoms. I hope that makes sense. And then massage guns, foot massagers. A lot of folks with EDS are dealing with chronic swelling, those type of things. So again, it's very much a tolerance thing. Doesn't matter whether it's EDS, HSD, lymphedema, cancer, diabetes, arthritis. That's a label. What are the symptoms? And if the symptoms are pain, if the symptoms are swelling, massage is a really good way, because sometimes the swelling causes the pain. Sometimes it's other things, but where you physically just don't have the ability, massage tools, the red lights, and even just using the vibration plate as a massage tool is a passive way to get some lymph and some circulation going. And if you can address some of the pain and the swelling by reducing it, you may actually get on with a bit of a life, or maybe your exercise, or go for a walk with your kids. What's motivating you to change your situation is unique for each of you. I find the more I talk about self-care and spot treatments and not call it exercise, the more motivated I personally feel. So however you have to get off your butt and start loving yourself and caring for yourself, there's never one way for every person. And if you're not a workout person and you're not going to get off your butt and use the machine, it's not necessarily because you don't want to. Sometimes you just found out, or you've been disappointed so many times with so many other paths. The mental needs a little bit of help. When you're in a bad mental place, it doesn't matter how many different things I show you. It's the mental game that gets you off that couch and off the path of, things that just aren't working. So I would prefer, red lights and infrareds are a really nice way to just start soothing your body and start moving and feeling better and changing that mental health to facilitate the next step. So don't beat yourself up. You are not here by any fault of your own. Many of you have been misdiagnosed, and I thank Life Pro again. I sound like I'm ready to go and get into a fight, but it's these sessions give us the opportunity to bring awareness to things that I guarantee I'm going to have a few membership requests by this afternoon. I will drop my link, but for those of you that are hearing about HEDS and HSD, I keep tripping on my tongue today, for the first time, there is help out there, and you do not need a diagnosis to start taking a proactive approach to your self-care. And Life Pro just happens to make it a lot more affordable and a lot more accessible. In many cases, even if you did have a diagnosis, by the time you pay your deductible and travel time, you could have bought 3 or 4 of the darn therapies they offer anyways. So, be informed and make informed decisions. You don't need the diagnosis. I always say to the folks in my group, you're the expert of your condition. You're the one living with it every single day. So stop being a victim. Thank you to those of you that came out today and advocated for the community and shared your conditions. If you did want to make a comment about what you are personally dealing with, or have something that you'd like to add, I'm going to give you a few more seconds to make a comment. Thank you, Mary Liz. She's dropped another one, hmsa.org. That's another great resource. We could do a whole session just on links. Mary Liz, you're going to become the go-to girl. We need to start the Mary Liz EDS page. But again, at some point, Mary Liz also woke up and went, something's not right. I'm not feeling good. So look at you and the pioneer that you've become. Empower yourself with information. And what you'll find is a lot of these things start making common sense, and it's this little language you're talking on your own. I see I've got a number of you still here with me. Mary Liz, thank you again for sharing these links. That's great. Hello, Kim from Camel River. Thank you for joining me. To Facebook user, I hope you're no longer in tears. And there's a number of resources here. I'm going to drop my own link. I should pull that up right now for you guys. If any of you are dealing with EDS and you're in my group and you're still scared to use my machine, today is all about motivation. There's no reason to be afraid. The help is there. For those of you who are hearing about this for the first time, perhaps you're a Life Pro group member and it's just some bells and whistles are going off. I've just dropped my link. Feel free to join my group. There will be questions to add. And share this session on the Life Pro main page, the public page, not the VIP page. Tag your friends, send it to folks once it's on YouTube. If you know someone that sounds like they're dealing with this, I had a few of you message me this morning about, I think I have friends dealing with this. Support them by sharing awareness, and many of them have tools and they just need a little support and motivation as well. Tracy, EDS coexists with mast cell activation syndrome and dysautonomia. I need some chapstick in a big way. Yes, Tracy, again, many of you, usually if you have one of these conditions, it's not just one. So again, don't just beat yourself up. A lot of things, if they're not just making sense, listen to that gut. That's often the sixth sense that we don't listen to. If it doesn't make sense, it probably doesn't make sense. So EDS, diabetes is another one I want to throw in there. There's a lot of co-conditions and the symptoms aren't necessarily unanimous. You might have 10 different conditions, but all you're dealing with is a lack of energy. So do your homework and understand how to associate them. But the help I've outlined today is going to address any of the symptoms regardless of the diagnosis. Mary Liz, thank you. I'm an EDS patient advocate. Knowledge is power, isn't it? And all it takes is a little bit of time. It doesn't cost you nothing. Are there any financial assistance programs for help with these kind of helping tools that insurance won't cover? Depends on your benefit. Some of you have, think of a vibration machine or a red light just as like home exercise equipment, home therapeutic equipment. If you have an awesome PT or caregiver, a letter of intent goes a long way to help you with your insurance company. A lot of your insurance companies do not have a code for a vibration machine. They do not have a code for a red light mask. It's not the device itself. It's the act of what you're using it for. So, gait training, balance training, things like that. Skin therapy, let me think, cosmetology, psoriasis management. Think about what you're using it for versus what the device is, because the insurance companies look more at the act of what you're using it for. Running, jumping. If you're about, why are you buying a treadmill? Because I need to be walking at home more. My doctor said so. Same kind of logic. And ask your insurance company, and there's some resources out there today. But every plan varies, as does every state. So there are some states that you may be able to apply for funding through, but it's not a universal thing. Same within Canada. Everybody thinks we got free healthcare up here. Only if you do the treatment that they've approved. If I want to use red light, that's not approved by my healthcare. I may have a medical benefit plan that covers it, But again, it varies per province, probably the same in the UK and Australia, wherever you're joining me from today. So it's more of an individual thing. After the posting goes up here, I expect some discussion. Tag each other and share all the information you want, because this is going to be a good link for that. Who else? I got in late. Is the meeting going to be replayed? Yes. As soon as I stop rambling and end this darn thing, you will see a recap on the recording will be both on the VIP and the main page. It will appear a little bit later on YouTube as well. Replying to Alicia Sanderson, it's being recorded. Marilyn, I love you. I'm going to have to send you a virtual kiss and a big hug. Thank you for coming and supporting me today so that we can support others. Again, thank you, Life Pro. I love doing sessions on these conditions that you think nobody's heard of. And then by the time we're done, oh my gosh, I think I've heard of that, or I know 10 people. Awareness is key. And if you can help someone else by paying it forward with good information, don't be, I can't use that word on camera, but if someone is taking the time and effort that is also dealing with a condition to share information, don't be a victim. I'm not here to dictate and hold your hand. You can help yourself. The more you learn and the more you empower yourself with information, the more you're going to be able to help and improve your own personal situation. So if this is the first you're hearing, if you have a question about something specific, there's usually sessions in Life Pro. So there's the VIP page. Use the search function. It's amazing what comes up when you look in the search function. And I know some of you get impatient with me. It might take me 8 hours, maybe 2 days to reply to you. But again, there's lots of resources out there. The more you self-serve and start looking up these things for yourself, the more you absorb the information just by digging for it. So thank you for joining me today. Hi, Nanny. Thank you. That is my mom. Happy belated Mother's Day. Thank you for joining me. My nanny is a big support. My mom, Ursula, as well. They both use all these technologies for different reasons. You don't need an excuse to feel good. Self-care goes a long way, and an ounce of prevention will keep you away from many of the things we're talking about today. Thank you so much, guys. Nanny, I'll see you here in a couple of hours when I get up there to Olds for Baton. Thank you, everyone else, for joining me. Again, if you have something specific that I didn't address in today's session, at Debby with a Y. Any of you that are joining me today and are aware of this, share far and wide and drop all the links you like. Let's get some awareness going for Ehlers-Danlos Syndrome Day. Charlotte, hello. My go-to phrase is motion is lotion. The more I move, the better I feel. Thank you for spreading awareness. I had genetic testing done once that showed a mutation on my there's so many conditional gene disorders you got to take a look at with this as well that causes EDS. Yet I wasn't officially diagnosed. So on my own, I figure out what helps. Again, thank you for sharing that. That really validates a point I said earlier, and I always say when you move, lymph moves. Your lymphatic system does not have a pump like your heart. To Charlotte's point, you do what you can. You may not be able to do some of the things that myself or some of the other members here can, but getting started is the hardest part. And even if it's just, you walked a little faster to the bathroom, or you took a step past the bathroom and a step back, progress equals rewards. And all of a sudden you're going to wake up and be doing the things that I'm doing just because you've been consistent with it. So motion is lotion. I like that one, Charlotte. We'll add that to our repertoire and do your research. That's how you learn about these conditions. And there's lots of links here that you can check out today. If you're joining me after the fact, I want you to if you're watching the recording, please make a comment. If you do have EDS or HSD spectrum of some type, make a comment and let's show how many people out there are actually dealing with this. Thank you so much for joining me today, you guys. Have a great rest of your week. And I will see you next Monday, same time, same place for Motivational Monday and some more information and sharing. Have a great rest of your week.